beautiful Tuesday morning, and at UC Davis, that means attendings are working and not residents because they're in their academic forum. An 18-year-old guy comes in, and he was doing what we know is the most dangerous thing you can do in the United States, which is minding your own business on the street corner. Now, this gentleman was attacked with a blunt instrument, a baseball bat. He was hit several times all over his body, but particularly in the face and particularly around the right eye. This image here shows a large amount of ecchymosis and edema in the periorbital region. This guy, I didn't get a picture of his external face or eye at the time, but he had such significant swelling that there's no way I could see his eye at all. I could not do an ocular exam. But based on the history and my exam, I was really concerned about an intraocular injury, primarily a globe rupture from blunt trauma. So what do? I grab the ultrasound machine. And I just want to make a note that the ultrasound helps me in a couple different ways. One, I can actually examine this patient, so I can do ocular movements, I can check pupillary response, and I can see if there's any damage done to the eye. Also, it helps me with patient flow, so I can actually diagnose the problem that I'm most concerned about right now. I can get trauma and ophthalmology to see the patient and make an immediate disposition. Now hold on, before you get too upset about me using the ultrasound in a possible globe rupture, you can do this safely. I mean, this guy has so much ecchymosis, so much edema, and I am so light with my pressure, and I put tons of gel on. There's no way I'm going to damage this eye. And additionally, it's important to identify pathology early so this guy can get treatment. I don't want to wait for the CT right now. Also, when the ophthalmology comes down and they pull that eye open or do whatever they're going to do to really evaluate it, they're going to apply way more pressure than I ever will with the ultrasound. So do it right, put a couple fingers on the patient for good probe control, apply a very small amount of pressure, apply a tegaderm over the eye if possible, and then a whole bunch of gel. Be very generous so that you're only contacting the gel and not the patient himself. And right when I put the ultrasound probe on, I can see there's complete destruction of the eye. The architecture is not even recognizable. There's echogenicity throughout the globe where it should just be anechoic. And I confirm my suspicion that this is a globe rupture. The eye should look like this. It should have an anterior and posterior chamber. You should be able to see the cornea and the iris and the lens, and the chamber should be clear, anechoic. There's just gel inside. So I get ophthalmology to come down immediately. They pry open the eye with a whole bunch of instruments, which has got to cause a lot of pressure to it. And the patient is so edematous that they can't close the eye after they dilate and use fluorescein. So what do? Same thing I do when I image the eye. They slapped on some gel and a tegaderm. They brought him right up to the operating room, and he had a posterior globe rupture that required repair.